welcome, Dr. Varun, to the Flawless Growth podcast. I am super excited to have you here.
Thank you for inviting me. It's a
Absolutely.
pleasure.
Okay, so
Mm.
let's start with the first question that would be if you could share a little bit about yourself, but maybe let's start with who are you maybe outside of work?
Oh, yes. So, my name is Dr. Varun Bharwad. I'm a medical doctor, foreign trade medical doctor, and now the healthcare administrator. I'm the executive director at the American Muslim Community Clinics, which is based in Longwood. And yeah, I'm a graduate of Masters in Public Health, which is my passion. And I'm also about to get it done with my PhD in healthcare administration. So, overall, it's
Very
like a
nice.
medical doctor who turned into the administration now.
Very nice, awesome. And as you mentioned, you've pursued a very interesting path, which MD,
Mhm.
MPH, now a PhD, as you said.
Yes.
And so, what motivated you to pursue medicine and then public health and research?
So I come from a country called India, where definitely it's a populated country. So we've seen like lot many people are lacking the healthcare,
Mm-hmm.
and that's how I grew my interest into the public health. And then I wanted to learn from the best healthcare system, which is in the U.S. So that's how I came as a student back in 2018, and that's how I got my more interest, going into it. And then one day, all of a sudden, it also grew into the administration part of it, because healthcare overall,
Mm-hmm.
as we say, the United States is like a bigger healthcare industry. So, but doing it from the non-profit, doing it for the people, I think that's what more exciting for me. So that's how I turned it into as a this director position at
Mm-hmm.
last. Is
Mm-hmm.
my kind of a passion. So that's worked out really well. Yeah.
Got it. Understood. And you touched a little bit about that the U.S. has the best healthcare system. Um,
Mhm.
However, there is sometimes it's hard to for people to be able to pay it, and there's like not a lot of help there. So I guess this is why a lot of nonprofits are born in the healthcare space. So what
Mhm.
would be maybe some of the main issues that you have seen in your space that your nonprofit is helping with?
Absolutely. Yeah, it's a great question. So as we know that US has the wider healthcare system. The only main challenging problem is it's more commercial, as in like
Mm-hmm.
it's a capitalist country for sure. So even though you get the healthcare, but at one price, and the price is money.
Yeah.
So not everyone can afford it, and in doing so, the government has not that many like a free system anywhere
Mm-hmm.
where come into the picture, where we rely on grants and some private donors' money. But there are certain ways where we can, open up our own free healthcare system, where everyone can be eligible depending on their income status. And like specifically for our American Muslim community clinics, it's the VC adult population, so 18 and above. Their income has to be 200% of below poverty guidelines,
Okay.
and if they are insured, then they can definitely come and get our services. So that's how it works. It varies in different states, but in
Mm-hmm.
Florida we are in right now, so we are a state-funded agency, and technically, if you see, yeah, we are serving for free.
Mm-hmm.
All the patients that we see. So yeah, it just works out. It's just that people are lacking the healthcare insurances, and government doesn't have that many options, but they sometimes gives the grants, like our organization, so that we directly give them the healthcare like that. So that's
Got
how.
it.
So it's a private, but in a collaboration with the public,
Got it.
from the government and the state government agencies who help us with the
Ah,
grants. Hmm.
interesting. Okay, so it's like if they were expanding kind of like their Medicare efforts, but with other private companies that are helping with that.
Exactly. I'll just tell you, basically, in the capitalist country, the only thing is, they will not be having the free healthcare for all, which is,
Mm-hmm.
we call it a universal healthcare. In the UK, in the Canada, they have a universal healthcare system where everything is for free for the citizens. The only challenge here in the US is, um, government still care for the people,
Mm-hmm.
The only thing is they do not have those resources. So whoever is doing it in case in our clinic, so they just give them the grant so that we take care of them proper way. So it's still there. It's just it's a different way around. But still, if no one knows our services, then they lack the services for sure because when they go to the governmental hospitals, they don't have any access over there, and if they don't know about our services, that means they are lacking the care. So that's what
Correct.
we are in between. Yes.
Correct. Very nice. And the people that, let's say, have Medicare sometimes would go to you guys because maybe it's a faster service or has a little bit more one-to-one treatments, or what would you kind of like differentiate that your nonprofit against compared to Medicare?
Yeah. Yeah, again, a good question, Miss Maria. So how it works is usually, we are a state-funded agency. Now, there's also some, agencies, we are federally funded agencies. So with the state-funded agency, we are not be able to see anyone who is insured. Doesn't matter if they have a Medicare, Medicaid, or even the regular private insurance. So yeah, because they already are into the system where they have the insurance coverage, so they can directly go and see their own providers. Our criteria is somewhat different. Whoever doesn't have the insurance, only them we can see them. So that's how it works. Anyone having insurance, we cannot see them. That's the main criteria because that's how we get the grants from the state government.
Okay,
yes.
Got it. Beautiful. And what would you say that led you to advocate towards health equity?
Mm-hmm. Yes, absolutely. So I'll just give you the simple example I always give it to everybody. So equity and equality, it's both are the different words, right? Equality is everyone is just equal, right? But when you're giving them the equity, as in if I'm having a short stature, right? If I want to see the volleyball game outside and there's a wall in between, right? So if I'm like a short stature guy, and if the other one is already can see it, right? So what I need to do, I don't need to give both the steps. I just need to give this person a step so that he can also be seen. He's already there. This guy just needs like an upliftment. So that way, we always work it out, and everyone can just get the basic human need services, which is the healthcare, and healthcare is human right. So we need to advocate for sure, because regardless of your race, religion, your height, body stature, anything, you're just a human, so you should be getting the healthcare for sure, and that's what we are advocating.
Yeah, health is the absolute number one thing for humans.
Yes.
If you have no health, then there's like that's your only problem, and that's it.
Exactly. Yeah.
Okay, and you have a very academic and professional load, and I'm guessing that can be sometimes challenging. So how do you approach that? How do you manage that?
Yeah, I guess it just goes with the choice. Some people are just here to prove themselves. Some are like more passionate. Some people are just born like that. So I guess I have more passion into the healthcare. That's why I got into the healthcare system. Like it was back in 2011 when I started my medical school, and it just guided me, and the spirit is still there. So I'm just kept going with that spirit.
Very beautiful. You guys are heroes for sure.
Right. Mm-hmm.
And how does your day to day look like as the executive director at American Muslim Community?
Right. So typically starts a day. Definitely, I have like household chores. I have two child, so just ready, getting ready them. Putting them into the daycare, and then that's how I start with my day. We typically have like dental in the morning, medical in the afternoon. So sometimes the day varies between like 9, which it starts in the morning, and then it goes up to 4 or 5 in the evening. When there is no medical in the afternoon, then it's just like a straight dental day. And then we have like ongoing operations, new meetings, new partnerships we are doing, because we are basically free healthcare system. So we also need to make sure if we are doing any family healthcare or the internal medicine healthcare, but definitely they need a specialist. So we usually refer them out within our network. We also want to make sure that once they get the services, it also needs to be free for them with the specialist. So we do those collaborations. So we have a really good partners like True Health, Advent Health, Orlando Health, Shepherd's Hope. All the non-profit organizations within the Greater Orlando, where we send them as a referral, and once they get it done, they come back to us. So we are like acting as a PCP for them, and then just people whoever needs a specialist care, they usually get it from them. So yeah, that's how it is. Like it's more difficult and challenging day by day, but yeah, overall, when you come home, when you're about to get sleep, you sense that sense of gratitude because you
Oh
have.
yeah,
So
absolutely,
that's
absolutely. So it's all
yeah,
worth it at that point.
right.
Yeah,
Yes.
it's like because I've talked with a lot of people that work in nonprofits, and it's
Mhm.
definitely very beautiful when you're helping so much, like a beautiful cause, instead of just maybe working at a company where you're just generating a lot of money, but it's just for the shareholders and stuff like that, and not just really with the people. So it's very very cool to hear all of these stories.
True. Yeah.
Yeah. And what impact have you seen so far?
Mhm.
Or maybe like, what do you think that's like been the most rewarding moment
Mhm.
that you've had?
Right. So I'll just share you a simple example. We had one of the patient due to the HIPAA law. I cannot say the name, but
Uh
yeah,
huh.
definitely. I want to share the story about that particular gentleman. When he came, he was in a pain with the dental a lot. He said like, today is a Sunday. I don't have any access. I don't even have the insurance. I called everywhere. I cannot go anywhere, and everywhere I go, they do charge a lot of
Hmm.
money, right?
Hmm.
Then with the referral, I just got your name, your clinic's name. We just came down here, and usually now I got to know that you only take through the appointments, right? But you still took care of me, even though we are not an urgent care system, right? Because you are in pain, and that's why we are here. Like here and then, not all the patients comes in, so
Hmm.
we just able to get help to him, right? And he was like really happy and smiling face, and when he said like oh my god, you guys really helped me a lot. And then
Hmm.
whatever that he had, he like he donated. We said like we do take donation, but
Okay.
it's not necessary because we are free, so we don't usually ask, not even to the patients like any money, right? But he
Exactly.
said like, no, this is what I have it, and this is like everything that I have it. I really wanted to do this because
Oh.
you just guys gave me my sleep, my pain away, and also you guys gave me a peace back. So, and that was like a sense of gratitude. So
Hmm.
that's how we work, and it's like really a sense of gratitude, I can say. It's
Yeah.
really services.
That is a
Mm.
beautiful story. Like first helping him with his pain that he couldn't afford anywhere, and then he also, even though it was not necessary, giving back and being so thankful. And maybe in the future he probably can like will keep giving a little bit if he can. So that's
Yes.
a great story.
Yes.
Okay, and what would you say that are like the biggest challenges that you face right now in regards to being a nonprofit clinic?
Uh-huh. So what usually happen, like, here and then definitely we'll be applying for so many grants every year.
Mm-hmm.
We also been able to get it because our model is like completely different. As I mentioned, it's a free healthcare,
Mm-hmm.
even medical and the dental. So um, our getting the grants ratio would be like almost 70 to 80% if we apply for it, because that attracts a lot that these guys are doing really who no anyone else does it.
Got it.
Now the current administration changes, with the DOGE and some other reforms along with the state regulations actually.
Uh-huh.
So people, especially the Medicaid and also the Medicare, but especially the Medicaid population, are getting denying with their services. So that means they are not providing the Medicaid to these patients. So
Okay.
technically, those patients now, they don't have any choice but to just go directly end up into the ER,
Oh
emergency,
wow.
where the bigger hospitals like Advent Health or the Orlando Health or the HCA Florida, especially in the Greater Orlando area, it's getting like full.
Right.
Now there is no way guarantee that they will be also getting paid for it, because
Right.
on a humanitarian ground they need to serve them.
Mm-hmm.
Now that botheration of the money, it's a lot for this Advent Health and the different hospital system. So that's how they partner with us. So technically, they just stabilize this patient, and
Mm-hmm.
technically, after the follow up, because by law they also need to have a PCP's appointment before they go out from the ER.
Mm-hmm.
So
Mm-hmm.
we become their PCP, even though we don't charge for it. But the thing is, the increase in number of seeing the patients is like really a lot right now nowadays, because almost
Wow.
there's more than 1 million people, I think, lack the Medicaid insurance, especially in this quarter. So, and this is,
Wow.
we are just talking about in Florida, so it's a lot numbers, and we are seeing already a rush in the number of appointments. So many
Wow.
patients when they come and get the medical, say, we had the Medicaid. I know it was also difficult to get the doctor's appointment with the Medicaid, but now we are at nowhere. We cannot afford it, and this is what's going on, and that's what we are here with you. And the another second challenge what we faced, so the funding, we are partner with different charitable trust organizations
Mm-hmm.
where they also lend the money to the organizations like us. So they say like also they got like less funding, which anyways they need to distribute to like our organization, like different organizations like us. So the funding is getting less, and the patient population is becoming more. So now there is
Right.
no connection. So we just rely on the private donations, and because we also need to get running with the point of amount. So that's the bigger challenge. So we are facing that, and
Got
this
you.
is, I think, happened for the first time after so many
Oh,
years running it.
wow.
So it's a really challenging one.
Very
Yes.
interesting. And how have you guys approached to try to reach more of that private public to be able to get more donations through that?
Right. So this particular clinic was established by one of the mosque. It's called American Muslim Community Centers, which is based in Longwood again, just like
Mm-hmm.
a block away from our clinic. So yes, within the mosque population, and also it's a word of mouth. There are
Yeah.
some local leaders, local Seminole County residents who are supporting this clinic from the day one, and it's just word of a mouth. And also there are some certain government officials who also push sometimes our grants to get it approved,
Mm-hmm.
because it has a unique approach that we do with the patients, like where we don't charge anything, right? So
Mm-hmm. Mm-hmm.
technically that helped a lot. Now we
Right.
also have a good partnership with Advent Health. So this is back in 4 years ago. They started giving us completely free blood workup.
Oh,
So
nice.
unlimited, yeah, unlimited number of patients, unlimited amount of blood work is completely
Beautiful.
free with the Advent Health, because in barter system we usually get to see their patients once they're discharged from their
Mm-hmm.
hospital. So like we also help them, but they also help us like that way. So
Right.
we have like this kind of like a system where we're trying our best, and we're also doing the research right now with Advent Health, so that we can also prove it that even with the regular small partnership with a small organization like us, it impacts a lot. And anyways, it's a fact now, because in the year 2023 and 2024, consecutively last 2 years, we are the number one clinic serving in the Central Florida,
Oh,
especially in
nice.
the county. Yes,
Very
and
good.
we see almost more than 5,000 unduplicated patients.
Wow.
Which number is a lot,
Yeah.
including the dental and the medical. And
Mm-hmm.
also we saw a rise in the mental health patients as
Nice.
well. We also started that services recently, like last year. So yeah, it's going really up. But the good thing is the operations are good. The doctors are also volunteering with us, and the Department of
Mm.
Health is helping us with that, onboarding those physicians as volunteers.
As
So
volunteers.
good.
Beautiful. And
Yes.
have you guys, with this change in some of the funding, have you guys had to do to fire people within the organization, or you guys have been stable in regards
Yeah.
to that?
So exactly like last year, if I recall, properly what happened, we also ran out with some funding. Like we only had like next 2 months of total funding, so
Mm-hmm.
we stopped some of the operations, not completely off, but like we were not taking like new patients because of that
Okay.
challenge. But we somehow also got to manage it through the fundraising and everything. So right now we are back to the normal pace and everything. We also have like secured of funding for like almost next 2 years or something. But the thing is, it's like a completely ongoing challenges. But the good thing about this clinic is like more than 80% staff is just the volunteers. So it's not like always that high payroll that we are doing, because all these doctors and the dentist, also the hygienist, they are like completely volunteers with us. So we only just take care of that, some administrative staff salaries and everything. So it's never like a stop we had to do with the regular stuff, even though our fundings were low. But somehow we maintained, and right now we are in a good shape, and
Good.
we're just taking more and more, even though with the challenges it's upgoing. So yes.
Beautiful,
Mhm.
beautiful. Yeah, that speaks of the great service that you guys do and how unique you are. So yeah, even in hard times, those are the kind of companies that survive.
Yes.
Okay, and do you have any like personal thoughts on how could the American health system improve apart from what you guys are doing? That's one solution. Do you think there's any other solutions that could help?
Yes. So I would like to emphasize on 3 points in here. So the very first and foremost is the governmental approach. Because of the ground reality, what we are seeing, because we also have a mobile clinic, so we have like a mobile van. We go to different places in a month, and we see like uninsured patients, but also the homeless population. So the very first and foremost challenge is homelessness. Um, and when we go and serve them in the camps like this, they say like, oh, really nice that you guys are coming and giving us the healthcare, but my main priority is the food and the shelter. If I will be in a good shelter with the at least good health, and with my food, then at least we'll be in a good health. So that's been more challenging. So I think there are some advocates within the Central Florida, which we already know. They are working really hard on it, so they are getting the fundings for them. So keeping away this homeless population towards the under the shelter. The second challenge what we saw is also they are not like having that much of the healthcare access. Even though sometimes patients will be knowing that someone just enrolled them with their social security numbers, and they are into the um, private insurance companies, where they sometimes don't know about it, and also sometimes they just lack the care because it's really hard to get a hold of these doctors appointments.
Right.
And that's how, and sometimes they don't even have the co-pays to pay for it. So that's the another challenge. And if they have the insurance, then we cannot see them. That's another challenge. And the third part I can say, so within the cities and within the counties, they have like always the extra fundings available, where sometimes they they have extra funding, but they are not like technically giving them the grants, like what's going around or something. So like within our Longwood city, the mayor is really great. So they usually make like every 6 months a kind of like a outreach, where all these nonprofits usually come meet in one under the shelf, and they talk to each other and see, okay, what are our main challenges, and we have some budget within the city, how we want to distribute, and let's see who is doing a good services, and which is our main priority. Is it the healthcare is a priority? Is it the food is a priority, or is it the hygiene or laundry? What is the priority? Like homelessness, what is that? And that's how they go and approach the system. So, and they also sometimes back these counties to give us the grants. So I guess there are so many challenges for sure, but if we just address one by one with the good advocates around, then I think that works.
Okay. Yeah, there's a long way to go, and
Yeah. Right.
absolutely. Okay, and looking ahead, is there any innovations in the healthcare space that you are excited about?
Can you repeat that?
Yeah,
Sorry.
no worries. Is there any innovations that you've heard in the healthcare space that you're maybe excited about?
Oh, absolutely. So how is AI reading one research recently that maybe within in like 10 years,
Uh huh.
people will not be needing the doctor actually. Then I started asking the patients, how do you think about it? Like one day it will be no one and just a robot talking to you, even
Yeah.
though robot man made, right?
Uh huh.
But what do you think about that approach? They said like, see, we are not talking about the generation alpha and the beta, but at least whoever the millennials are, baby boomers, and the Gen Z's,
Z.
right? They
Gen
will be
Z.
still prepared to see the population who is already seeing the doctors like in person. So that approach, people will be still doing it. But
Yeah.
nowadays, like with this all the like robotic surgeries, like someone, the doctor is doing it from here to all the way to the Japan, right? So
Right.
there's so many
Wow.
innovations that are going on, and automation is like completely helping a lot. So that way it is like going beyond. We also need to make sure. I think there's another thing I was reading that with this AI, I think every country needs to have like AI laws on
Yeah.
specific the medicine. Otherwise, if it is going wrong the other way, then it might be in the problem. So I think the Congress also needs to address that and see, what can be the other, kind of like laws they can bring in, and see how they can restrict not going everything as automated, so
Right.
that at least it doesn't harm anybody. That's the main approach. So
Yeah,
yes.
I think they should like start doing that right away because it's going so fast.
Yes.
And yeah, you kind of have to teach the robots somehow a little bit of human thinking and
Hmm.
human touch.
Yes, exactly.
Okay.
Hmm.
And now, in regards to for you guys to grow or get donations, or apart from the grants that you guys have with the government, do you do any kind of digital marketing to spread awareness?
Yes.
Okay.
So I'll tell you the story, a little bit story about the AMSS clinic. So back in 2016, we have started this clinic. So in the year of 2017, even though we were providing the free healthcare, first thing is no one will trust you. The second thing is no one knows about it. The third thing is like there's not that much of awareness in the
Yeah.
community. So we used to send them. We had at one point of time we have like a billboard. We were like doing the outreach like that way, that hey, this is a free clinic, please come
Uh-huh.
and get services if you're eligible to get it. Now, we see like all kinds of patients, all race and ethnicity and everything, right? So we used to send like in the Spanish newspapers, all this small advertisements that hey, we are the open clinic here in Longwood, and if you wanna just come and get our services. We also outreach so many churches around
Mm-hmm.
in case if if they want to be seen or something. And also there's a good thing about our services is we are not even you know to get the services, like they don't have to be like US citizens or the
Oh
and
wow. Okay.
have legal status or something.
Uh-huh.
So technically, anyone who has, we always say like anyone who has pulse, if they are leaving them, as we can see.
Yeah.
So that way of approach we have done like from day one. And anyways, there is no like, even with the grants that we get it from even the state funding or even the private donors, there is no such thing in the obligation that we deny the services to anybody with their legal status
That's
or
good.
whatnot. So that's how we cover for all.
Mm-hmm.
And this is like kind of like a public clinic, even though it's a private, but it's kind of like a public clinic for all. It's just that with the with some challenges right now going on, but we are still steady and get going with seeing almost the same, even more than what the number of patients we saw last year.
Very good.
So it's going to go even still more, I believe. So
Very good.
yep.
Awesome. And do you guys have maybe like a person who's in charge of digital marketing, or is that between all of you together?
Yeah, so we have our own data analytics team. They do provide every month,
Mm-hmm.
um, the statistics to our administration department,
Mm-hmm.
including me. But every quarter we have our own newsletter where
Nice.
we publish everything,
Uh-huh.
and then so we have like two newsletters coming in like every year,
Okay.
which is every quarter, and then we also have like a final newsletter also comes like once a year. So
Okay.
technically four newsletters we have it where we publish everything, even our loss and profit statement as
Oh,
well, because we don't,
really?
yeah, so we don't need to hide it to anybody, right? So
Very
we
cool.
share it like with everyone, because that's way it's like technically, see, if we are not doing wrong, then why we need to hide anything, right? So we keep it like public. So we
Mm-hmm.
just put it newsletter, like in the annual letter, we usually put it absolutely the profit and loss statement. So also they'll get to know that, hey, this many grants and this many money came from the private donors, but it was utilized this way, and we have this much in reserve, and it also helps us in our fundraising in the future. So,
I
but yeah,
think that
and I'll
that would.
also tell you. I'm sorry. Go
Sorry,
ahead.
no, no, go ahead. I interrupted you.
And as I mentioned also that we have like more than 80% all this volunteers.
Uh-huh.
So all the medical and the dental assistants are more the pre-med and the pre-dental students. Where they come, they also get to know the services. Also, we give them like a full hands-on, which not all the clinics give it.
Okay.
So it's like a good learning curve for them, and that way we also help them, building the resume. Sometimes they need it for like a medical school or the dental school, and they eventually come serve in our clinic for like 1 or 2 years. We go to the medical school, and we have some providers now who were like at one point of time our volunteers. Now they are fully graduated, professionals, and now they are serving also our community. So
Oh, I
it's
love
a
it.
really great services that we are doing in the community. Yes.
Absolutely. Because, yeah, it's not just helping the people that need it, but also helping a lot of people with their education and their practice. So
Absolutely.
amazing. And have you ever heard about Google Ads grants?
Um, Not that much, but I've heard about it.
Okay,
Yes.
yeah, that's something that you guys should explore because they have this program where if you're a nonprofit and they accept you, like you send them the paperwork and everything, they give you $10,000 for free on ads.
Okay.
Yeah, and then so that way people can either if like go and find you to get your services or also to reach people that maybe want to donate and you can do it through the whole United States as well. So that's definitely something that you guys should look into.
Wonderful.
Yeah.
Good to know. Thank you.
Absolutely. And what do you think it's the biggest challenge that you face in regards to digital marketing or spreading awareness online?
Uh-huh. Yeah. So there are some restrictions sometimes when we share with the HIPAA things. So we can like when we share the testimonies of the patient, we don't need to share the names and everything, right? Now sometimes people have their perception that maybe whatever the comments or whatever that they're seeing, it's like fake, right? Until they actually come in person and get the services, or they heard it from someone who already got the services. So I think within the outreach, I can say we never have to like advertise a lot, because especially what happened like during and after the COVID. I'll also tell you this thing. So during the COVID, we were the first agency to get the COVID vaccine to give it out to the patient.
Okay.
Because Department of Health is our biggest supporter. Department of Health is basically a governmental agency who takes care of all the licensing of the providers and everything. And I'll also need to share you this. So all our providers who are volunteers, including the paid staff, the doctors, they get this sovereign immunity, which is the kind of a malpractice insurance, where technically because they are serving the community, right? So no one can sue our clinic technically.
Oh wow, okay.
It has been provided by the Department of Health, which is actually a governmental thing, right? So because we are a state-funded agency, so that's how also all these provider get their community hours also within the community services, and they get services, and patients also get the like a great services that we do. So that's how the collaboration works actually. Yes.
Very nice. I love it. That is amazing. That they, yeah, because I can't imagine you guys also dealing with law issues apart
Right.
from
Yes.
everything you're doing. Okay, Varun, thank you so much for sharing all your knowledge and your insights. It's amazing what you guys do. Where can people learn a little bit more about you or about AMSS Clinic?
Thank you so much. It was an honor to be in the podcast.
Absolutely. So to find you guys, like you would just find American Muslim
Social Services Clinic, or
Okay.
they call it as American Muslim Community Clinics.
Okay.
So they call it as AMSS Clinic or AMCC, which is in Longwood.
Perfect. And your name in LinkedIn if they want to connect with you.
Yes, so we have a website which is amssclinic.org.
Perfect.
Where they can directly sign up as a patient. We have our own outreach team, so we usually ask, and call the patients, set up an appointment, and it's just solely on the appointment based, and they can directly get the services. We try our best not to go beyond 2 weeks of the wait list, so that everyone can be seen, because they will only sign up when they have something going on.
Okay.
So we have to make sure that the deadline is like 2 weeks. So we also encourage more volunteer doctors to join our clinic, and whoever wants to be the part of the clinic, like as a medical or the dental assistant. Yes, I have a lot many volunteer opportunities as well. Nice. Within the medical and the dental.
Okay.
Yes.
Beautiful. Okay. Thank you so much, Varun.
Thank you.